So we've percussed, and now what I want to do is, another thing for lung expansion is I want to check his diaphragmatic excursion. David, I want you to take a deep breath and I want you to hold it in for me as soon as I tell you to, not right this second. I have to get a pen. Okay. Okay. Deep breath and hold it. And you can breathe. And now I want you to take a deep breath in and out and then blow all your air out. Ready? And hold it. And you can breathe. And if I measure the diaphragmatic excursion, he measures about 3.5 centimeters, and normal diaphragmatic excursion is 3 to 5 centimeters. So you did good there. Okay. The next thing I would like to do is I'm going to auscultate his lung fields. Again, I'm going to use a systematic version when I auscultate. Breathe in and out. Deep breath. Okay. Good. Now what I'd like to do is I would like to do the bronchophony test, in which case I'm going to ask David to say 99, 99, 99, 99 every time I touch him with the stethoscope. And this again is looking for any consolidation, any fluid, things of that nature. So David, when I touch you with the stethoscope, can you say 99? Ready? Go.
99.
Good. And I don't hear, it's a little muffled, and that's the way it's supposed to sound. The next test I want to do is called whispered pectoriloquy, and that is the same as bronchophony. And what David's going to do is he's going to whisper 99. I'm not supposed to hear it very pronounced. If I do, that means that there's some consolidation. David, can you whisper 99? Good. The next one I want to do is called egophony, and that is the E to A ratio. And if David says the letter E, it should not sound like an A. Okay, so that's the E to A ratio, and we'll just test it the same way. Say E.
E. E. E. E. E. E. E. E. E.
Good. And I did not hear anything advantageous. Okay. So the next thing I want to do is I'm going to check his anterior chest. So can I have you just kind of swing around, David? Okay. And again, I'm looking for his respirations. I'm looking at his skin color and tone. I'm going to palpate. I'm looking for any thrills or pulsations, and I don't see any. I cannot see his apical pulse, and I'm just going to palpate again, and I'm going to feel for his apical pulse. Okay. All right. Again, I'm going to check for that tactile firmness. David, can you say 99?
99,
Again.
99, 99,
Can you lift your arms up for me when I do that? Again?
99, 99.
Good. Okay. And again, I'm going to percuss the area as well. Can you stand up a little straighter? Thank you. I'm going to percuss this area as well, and I'm going to go in a systematic manner. Okay. And I don't hear any dullness. Dullness could mean that you might be on a mass or something of that nature. Okay. Then I'm going to auscultate his breath sounds anteriorly. And I'm going to start way up here, in the supraclavicular area. Deep breath. Again. Sounds normal. The next thing I'm going to do is I'm going to auscultate his heart tones. Breathe normal. All right. And I'm listening for S1 and S2. I didn't hear any gallops. I didn't hear any bruits when I was auscultating his anterior chest, or any thrills, or anything of that nature. Okay, so we did the upper extremities, we did the chest, we did the back. The next thing I want to do is your abdomen. So if I can have you lay down for me. The first thing I want to do is I just want to look at the abdomen. I want to note his contour, any movement, his respirations. Everything looks even, unlabored. I'm going to note his skin tone, hair distribution on his abdomen. Okay. And then the first thing I want to do with his abdomen is I want to auscultate. I'm going to auscultate all 4 quadrants of his abdomen. I do note that he does have quite a large scar here. I know you had some surgery in the past, so it's about, I want to say, 24 centimeters. It's a pretty big scar. And the next thing I want to do is I want to auscultate his aorta. Renal arteries. Iliac. And I would auscultate his femoral arteries if his hands were off. Okay. The next thing I want to do is I want to percuss his abdomen, and I'm going to use the same systematic manner using my middle finger, and I'm going to percuss all 4 quadrants of his abdomen. And it should feel be timpani, and it does. The next thing I want to do is I want to percuss his liver border and I want to do the liver span. So I'm going to percuss just right of the midclavicular line, and I'm going to percuss down. I will mark it, and then I will go on to percuss from the bottom up, and we will see how long or how big of a span his liver is. It should be about the 5th intercostal space for the upper border. And if we measure that, he is about 7 centimeters, and normal liver span is between 6 and 12 centimeters. The next thing I want to do is I'm going to percuss his spleen, and it's really difficult to percuss the spleen because it sits underneath the rib cage. Okay. The next thing I would like to do is I'm going to do light palpation on his abdomen. And again, I'm just doing all 4 quadrants, and light palpation is basically just looking at the muscle tone. You may be able to palpate masses, but it's very unlikely, and his abdomen is palpated just fine. Okay. The next thing I want to do is a deeper palpation, and when I do my deep palpation, I'm really looking, I want to feel the border of the liver, I want to try and feel the border of the spleen. I am going to deep palpate both kidneys and, of course, the aorta. Okay. David, can you take a deep breath for me? Deep breath. Okay. All right. And another deep breath. Okay. And put my hand under here and just try to palpate your kidney. And on this side. Good. Okay. And your aorta. Okay. And I could not palpate, I could not feel his spleen, and I could not feel his liver or his kidneys. Sometimes you can palpate the right kidney, depending on the abdominal girth, whether the patient is heavier or thinner. Okay. So I palpated his abdomen, and I auscultated his abdomen, and we percussed his abdomen, and we listened for the quadrants and the aorta, the arteries, so we're good with his abdomen. So the next thing I would like to do is I'm going to look at his legs. I am going to look at his skin, his hair distribution on his legs. Put the shirt over here. Okay. Skin, hair distribution, see if there's any edema. I'm going to feel his temperature of the skin. Okay. And I'm going to palpate his pulses, post-tibial, or dorsalis pedis, post-tibial, and his popliteal pulse. Okay. I'm going to look at his toes. I'm going to check his capillary refill in his toes. Okay. David, can you pull your toes back? Good. And push them? Good. I'm going to do a Babinski reflex, and when I do this, his toes should be flaring down, and they can, on both sides. The next thing I want to check is I want to see if he may have a DVT, so I'm going to push up. Does that hurt on your calf? Okay. And the other side. Okay, good. Okay. I want you to sit up and kind of turn yourself around here. Okay. The next thing I want to test is I'm going to test his reflexes. And I'll start with the brachial reflex. Be relaxed, please. Okay. And the radial. Good. See your hand move like that. And popliteal. Good. And Achilles. Good. And I would do that bilaterally on both sides. The next thing I want to do is test for sensation. Can you close your eyes for me? And I want you to tell me if it's sharp, pointy, or dull, okay? The next thing I would like to do, if you could stand up for me. I'm actually going to ask you to do a couple of squats. Just put your arms out and squat down for me. Squat. Good. Again. Good. Okay. The next thing I want to do is I'm going to test your, you can just turn around for me. I'm going to look at your cervical spine again. Okay, can you put your chin to your chest? Good. Put your head back. Look to your right. Look to your left. Good. Try to touch your ear to your shoulder. And the other side. Good. Now I want you to bend down for me and touch your toes. Try to touch your toes. Good. And I'm looking at his thoracic or lumbar spine, looking for any scoliosis or any curvature. You could get up now, David. Good. Okay. Can you, with your hips straight, can you just bend to this each side? Good. And bend to the other side. And back. And forward. Good. And that concludes my head-to-toe assessment. Thank you for helping and thank you for watching.